Health Secretary Robert F. Kennedy Jr. is downplaying reports that he is ready to announce a possible correlation between autism and one of the most popular pain relievers on the market. The Wall Street Journal reported late last week the Department of Health and Human Services is expected to link Tylenol taken during pregnancy to the developmental disorder. The report also says Kennedy will suggest a type of folic acid can treat autism. Secretary Kennedy was on Fox News yesterday morning and had this to say about the journal's reporting.
There are years and years of studies about that we are looking at today for the first time, and we're finding a number of different indicators, a number of different signals. But until those, and as soon as we have enough information to give to the public with confidence, we are going to do that. But anything that happens, any speculation about what's in those reports at this point is speculative.
And for more on this, Dr. Brian Lee joins us now. He's a professor of epidemiology at Drexel University. Dr. Lee, thanks for being with us today. This certainly got a lot of people's attention. What kind of research is there on Tylenol and autism, the link between it? What does that show?
The evidence to date shows that the possible association of Tylenol with autism is likely confounded by other factors. In other words, a third factor explains the statistical association.
Okay, so given all of that, if you're a parent and you listen to this and you're seeing these reports come out, can taking Tylenol have any harm on children, though, both before or after birth? Would you recommend it for parents to give?
Well, the available evidence says to date that taken under the proper conditions with, the proper supervision of physicians, that there doesn't appear to be any excess risk of neurodevelopmental disorders. The expert agencies, American College of Obstetrics and Gynecology, Society for Maternal Fetal Medicine, all of them have weighed in on this topic and have not found any evidence to suggest that the safety of Tylenol is in question, at least for neurodevelopmental disorders.
Okay. And then, Dr. Lee, we had also mentioned folic acid there as a possible treatment for autism that was being floated there. Is that feasible? What do treatment options look like right now?
I think the research is too soon to tell regarding folic acid and autism. There's certainly some evidence out there, and some researchers are speculating, but in my opinion, the evidence is not well developed enough to make any sort of therapeutic recommendations.
And Dr. Lee, finally, the CDC says 1 in 31 children have been diagnosed with autism. That's increased over the last 2 decades. Is there a sense of why?
What we do know is that a lot of other factors not related to a true increase are at play. For example, greater recognition of autism, better diagnosis. All of these factors seem to play in. As to whether or not increases in environmental factors are involved, I think that's an open question that researchers like myself are investigating.
All right. Well, we'll stay tuned for those results then. Dr. Brian Lee, thanks so much for joining us today.
Thank you for having me.